And early research had suggested that about 1 in 3 people will continue to have symptoms of COVID months after being infected, meaning millions of Americans are still struggling to get back to normal. And now that we've dealt with COVID for nearly 2 years, we know more about this virus, its mutations, its impact on your long-term health. Lisa McCorkell is with the Patient-Led Research Collaborative. That's a group that's been studying the so-called long haulers for months now, and she joins us tonight. Thanks for being here.
Thank you for having me.
So as we've been saying, the scientific community is learning more and more about long COVID all the time. What are the signs, and how do you know you're experiencing long COVID and not some other health issue?
Yeah, so long COVID is likely several different health conditions. So we know some of them. Some of them look like myalgic encephalomyelitis or ME/CFS, dysautonomia, mast cell activation syndrome. But there's some conditions that long COVID is that we haven't necessarily yet defined yet. But basically, kind of the way you know if you have long COVID is, did your symptoms start with a COVID infection? And that can either be confirmed or a probable case. And it also happens after asymptomatic infections as well. So if you have a PCR positive test, you know that you had COVID at some point, you develop symptoms within a month or two of that COVID infection, you may have long COVID.
Does it affect some groups more than others? Have we found that out yet? I was reading that it might affect women more prevalently than men.
Yeah, we don't have great data on that. There is, some data that indicates it may impact women more. But I think the really important thing to take away is that it affects people of all ages. It affects people who were previously healthy before COVID, did not have underlying conditions. I myself, I am a long COVID patient. I was previously healthy. I'm 29 years old. I'm not necessarily the typical person you might think has long COVID, but that really is, it spans all demographics.
Do you have any insight into whether the vaccine affects long COVID, or if people who get multiple cases have any difference in their long COVID symptoms?
So we're seeing from the vaccine, there are breakthrough infections, unfortunately. So people who have the vaccine, we don't know how much, if any, it reduces your risk of long COVID, but we are seeing breakthrough infections. We are also seeing that if you have a reinfection, so if you initially had COVID, did not develop long COVID, then get COVID again, you can develop long COVID with your second infection. In terms of the vaccine, people who have long COVID that get the vaccine have very different reactions. Some people have their symptoms get a lot worse. Some people, their symptoms get a lot better. There's just so much unknown at this point.
Yeah, that's a lot of unknowns. I was reading through the study a little bit. It said that testing really plays a big role. It said that almost half the patients couldn't even get a test, and that the researchers believe current testing isn't even capturing a large subset of patients. Do we know who we're talking about? Do we know what kind of difference that could make in the results?
Yeah, so PCR and antibody testing has been inaccurate since the beginning of the pandemic, or not fully 100% accurate. So even with antibody testing, that is more men and people between the ages of 40 and 70 they have more accurate antibody testing. So women are more likely to have, not accurate antibody testing. For PCR tests, the best day you can possibly get a PCR test is on day 3 of your symptom onset, and there's still a 20% false negative rate on that day. And with Omicron, that kind of throws it all for a loop. There are reports that testing is not as accurate for people who have Omicron cases. So it's really tough because a lot of healthcare access, disability benefits, a lot of things that long COVID patients need are hinged on this PCR positive test. And if we don't have accurate testing, then how can all these patients get the care and resources that they need?
Yeah, there's so much still to learn. Based on what you've learned, though, over the past couple of years, are you taking a look at long term, like maybe a decade from now? Do you have any predictions? Do the researchers have any kind of insight into what the long term effects may be for the long haulers?
So, I mean, one of the kind of, I think the big thing here is that we do have evidence from previous coronaviruses of people who have been disabled for decades with ME/CFS, who have, developed dysautonomia and POTS. So unfortunately, what we're looking at is likely people who are going to be disabled for decades. There will be some people who recover, but not everyone will. And a significant amount of people are going to be out of work, especially with this new surge in Omicron cases, where we're seeing cases that are, the highest that they've ever been. We are really concerned that in a decade, our workforce is going to be significantly lower. We're not going to have the supports and healthcare access that we need, largely because a lot of these post-viral illnesses that have been around for a long time have been not prioritized.
Wow, that is definitely something to think about. We've been thinking in the short term and the present and getting through the next day and week and month. And when you think about decades later and this having an impact, it's pretty mind-blowing. We appreciate your insight tonight. Thank you so much for coming on the show.
Thank you.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.